This is a brief summary of why anxiety is important when thinking about the behaviour and well-being of people with severe intellectual disability and complex needs. So anxiety and fear are our body's inbuilt response to danger. So when we're anxious or fearful, our hearts beat faster and blood is directed to our muscles so that we are ready to protect ourselves from the danger. So you might have heard this as being referred to as our fight or flight response. And anxiety can have an effect on someone's well-being because being in the situations that cause anxiety can be extremely distressing. And that may result in those situations being avoided, which can also affect well-being. Anxiety can be a cause of challenging behaviour because people with severe intellectual disability and complex needs are likely to find it difficult to communicate that certain things make them feel anxious. So the presence of challenging behaviour in certain situations or in the run-up to those situations can therefore indicate anxiety. Anxiety can also be an indirect cause of challenging behaviour because it impacts on other things that also cause challenging behaviour. So for example, people who are anxious also tend to experience poorer sleep. And it's hard to know if someone with severe intellectual disability and complex needs is experiencing anxiety because communication of anxiety requires a person to identify their internal state, to label that as anxiety, and then communicate that to somebody else. So we therefore look to behaviours as indicators of anxiety. For example, signs of physical discomfort. But this is complex, as some of those behaviours may also indicate something else, such as unidentified pain. The assessment of anxiety will usually involve questionnaires or interviews, which can be completed by parents or carers. In order to obtain a diagnosis, interviews that adhere to standardised criteria are needed, but these criteria were developed for people without intellectual disability and therefore might not capture the complexities of the presentation of anxiety in people with intellectual disability. Anxiety can be reduced in a few different ways, so predictable routines with the gradual introduction of flexibility and also letting a person know when a change is coming can help, particularly when anxiety is around specific anticipated events. In addition, supporting a person to use self-calming strategies like listening to calming sounds or music, deep breathing, squeezing a ball or chewing on a chewy tube can be helpful. As well, supporting a person to increase their communication of anxiety is also a useful strategy. So this might be identifying a way that the person can say stop or I'd like to leave. And on that note, really, whilst avoiding situations that make people anxious is really tempting in order to alleviate that anxiety, small steps and gradual steps to introduce a person to a specific feared situation can help, particularly when that person's anxiety is specific and, importantly, when nothing bad happens when they're in that situation. That's because over time, people can often learn that they can cope in those situations. Underlying physical or sensory issues might also exacerbate anxiety, and so taking steps to identify and manage those can indirectly help then with the anxiety. There are a number of medications that are often prescribed to adults displaying anxiety, but currently little is known about how these medications work in children and adults with complex needs. So it's really important to discuss that area with your GP. And you can find more information about anxiety in people with severe intellectual disability and complex needs in the Cerebra Anxiety Guide.